Hello, I'm Dr. Dennis McKenna. Today I'm joined by Fran Spear-Alpert. Fran, welcome.
Thank you so much, Dennis.
Great to have you here. Fran is our Chief Financial Officer and our Chief Operating Officer, and we'll have a lot to chat about in a couple minutes.
Great.
All right, wonderful. Today is Thursday, January 20th, giving you the update from Albany Med. I should say, great color choice today. Great.
Why, thank you.
There you go. All right, let's pop open the first graph here. These are the cases in New York State that are in the hospital with COVID. That number is 12,027. If you look very closely at that graph, you can begin to see that line shows that the number of cases is actually coming down. Next graph here is Capital Region cases in the hospital with COVID, 432. Again, we talk about this. There's a difference between those that are with COVID, those that are coming in because of COVID. This number includes both. But increasingly, we're seeing about 1 in 4 people who come into the hospital come in with COVID. They don't know they have it. They come in for a different reason, and we diagnose it. So that's that 432. Next graph here is admissions and discharges just to the medical center. The one thing you can see here is there's some wide swings. Some days we bring in close to 20. Other days we may bring in less. Certainly the discharges will increase or decrease depending on the day of the week. But then the next graph here shows you the number inside with our morning census. We currently have 120. Of those 120, let's break it down, Fran. We have 98 on the floor. We have 22 in the ICU. Interestingly, as that number goes up, you seem to see an increase in the number that's considered no longer infectious. These are people in the hospital, they're still testing positive, but they're not in a situation where they can spread it to anybody. They're no longer ill with it. There's 14 of those 120 that are no longer infectious. That 120 breaks down this way as well. Adults, 110, and pediatric and adolescent represent the other 10. So that's the breakdown there. In the last 7 days, 108 people came into Albany Med diagnosed with COVID. Still 3 and 4, 75% are unvaccinated. That continues to be the driving number there. Just a couple other numbers that people often ask about. If you look in the capital region, the percent positive, so that's everybody being tested for all different reasons, symptomatic, asymptomatic, pre-procedural, they were exposed. The number that test positive is 16.2%. That number is actually coming down. A week or so ago, that number was as high as 20%. And you can look on a graph. It is absolutely coming down. If those people test positive, what is the likelihood that they land in a hospital bed? It's about 2%. So it's really about 1 in 50 of all those that test positive end up in the hospital. One more graph to take a look at here. This is the breakdown on the different variants, and what you can see now is it is almost exclusively Omicron. 98.4% of those samples that are sent over to Wadsworth are Omicron. One thing that people sometimes ask is, those who land in the hospital, what is the reason why they land in the hospital? Some of those people are still coming in because of Delta. We know Delta was more likely to land people in the hospital. This represents all the people that are tested, including those in the outpatient setting. All right, and then the last thing, no flu. We have, I think, 1 person in the hospital with classic influenza. That is not something we're seeing very much of this season either. We'll follow that very closely. All right, let's jump into some other topics. Yesterday was our birthday.
Outstanding.
So Albany Medical College was formed in 1839, and the hospital was formed in 1849, and the two of them came together to create the Albany Medical Center on January 19th, 1983. So that makes us 39 years old. And we had a great day yesterday.
It was fantastic, and it was so nice to see everybody get so excited for this event.
And let's talk about one person in particular who really made that happen, which is Stephanie DeBacco. She organized all of that. Hopefully all of you had some treats brought to your floor, some Albany Medical Center cookies and a proclamation and a celebration of our workforce. She was really driving a lot of effort behind the scenes on that.
She did a great job, and it was a fantastic opportunity for all the teams to get together, celebrate, and learn a little bit more about our history.
And it's very important to think about where you come from so you know where you're going. And what was really fun yesterday is it was a chance for us to celebrate on each unit who was the employee who was the newest employee on that unit and who had sort of worked there the longest. And it's sort of a representation of our past and our present and our future. And I hope you had some fun with that. We're going to make that a tradition every year.
Love that.
Yeah, that was wonderful. Fran, another thing which we're doing more frequently is something called senior leader rounding. Now, in your role, you have two roles here, very important. You're the chief financial officer, you're the chief operating officer, but you are also someone who increasingly is very visible to our workforce. Talk a little bit about senior leader rounding. What is the purpose and what are we looking to accomplish?
So most importantly, what we want to do is let our workforce know we're here for them. We listen, we see them, we know how hard they're working, and we appreciate every single thing we do. I really enjoy senior leader rounding. It is so nice to see people in their atmosphere working as a team. They are always so gracious and happy to see me as well. I appreciate them and they're grateful to see me, and it's just a wonderful experience. So again, we want to get out there, say hello, say thank you, and give people a chance to see us in person, ask questions, tell us about experiences they're having in their work area.
Each day it occurs between 8:20 in the morning and 9 o'clock. There's a core group that go out. We go on different routes each day. The hope is over the course of a couple weeks, every single unit will see all the different leaders coming through. I agree with you. I think it's lots of fun. And what I really enjoy about it is because we have a schedule, we are sure that we're going to hit all the areas. There's parts of this hospital, quite frankly, because it's so big, that sometimes, unless you find your way there, it's hard to find your way there, if I can say it that way. But just in this last week alone, I found myself down at the PET CT area, back in cytopathology, all these places that do really important work, and often you don't see them because they're maybe a couple hallways down and around the corner, but it's really a great chance for us to see them. And you do something very special. I think people are starting to learn that when Fran comes, you bring a cart with you, and you like to sort of share some treats, which I know everybody really appreciates.
I know how busy everyone is, and it's so hard to get off the floor, to take a moment for yourself. And I frequently bring treats, as Dennis described, on the cart, and folks are so appreciative of that. And I do also raid Dennis's refrigerator every morning. He has a refrigerator with lots of bottled water, so I fill it up every day.
Take them.
But it's so much fun, and I love how we've reserved time every morning to do this. So it's earlier in the day, and it just sets a tone for such a wonderful day for all of us. It's the best idea. Have to thank Don Weisenforth and John DePaula, who really encouraged us to hold this time every single day specifically for rounding. And again, thank you to all who have been so gracious when we show up on your units when you are working very, very hard.
Yeah. And I agree with everything you said, and I do think they appreciate the little treats, but I also think the thing they appreciate most from you is you're very genuine, you connect with them. There's no question that you bring a certain spirit and energy and happiness and joy to them, and they enjoy meeting you and seeing you every day. So great job there.
Best thing about this job is the people we all work with, and so rounding gives you that opportunity to be with them.
Absolutely. Let's talk about some other very positive news. As has been announced, and I got some emails from members of our workforce very excited about this. We are going forward as a system with a new electronic medical record and a new ERP. I think everybody knows what a new electronic medical record means because we're in it all the time, and we're moving to something called Epic, which is a world-class platform. 19 of the top 20 academic medical systems in the entire country use this, so we're taking us down the journey of having the best. But Fran, what is an ERP? What does that mean to people who don't know what that term means?
Sure. An ERP is our financial system, our financial platform, our supply chain platform, as well as our human resource and payroll platform. So in other words, today you use Lawson when you're going to order a particular product or supply for your unit. You use Workday when you're looking up aspects of your pay, approving certain things every 2 weeks for your team. So what we're going to do going forward is move the entire system onto Workday for all of those functions. So in other words, we'll have one integrated platform for human resources, for financial reporting, and for the supply chain. We picked the absolute best. This is so user-friendly, has so much more functionality than we currently do, and better yet, all 4 of the campuses will be on this platform.
And it is no question about a very significant investment we're making in both the EMR and the ERP. But we think there are some significant benefits, not only to our workforce, but to the patients we serve in our region. Can you talk a little bit about the benefits we're going to get out of these systems?
I sure can. So in terms of what it means to us as a system, without a doubt, this is the most important, the most significant project we've undertaken as a system. It will help us come together, work as a team, plan as a team, schedule our workflows as a team. And it really will facilitate the integration that so many of us have been hoping to see, and facilitate that teamwork that so many of us enjoy, and take the best from all of our 4 campuses and put it into one product. You know, more importantly, what does this mean for our community? They can go to any point of care in our entire system. Right. The same information will be there for them. The providers will have all of their medical history, no matter where they presented in the system. This is of tremendous value to their care and to their family's care.
Yeah, we are very excited to start this journey. It will take us a while to get there, a few years, but the work begins this year. And I think the benefits will be almost immediately obvious to everybody when we go down that path. And I think that there's no question about it. It will transform the way care is delivered in our system going forward. You'll be heavily involved in it.
Yes.
Chris Couchet, our Chief Information Officer, obviously will be heavily involved in it. All the campuses, Columbia Memorial, Albany Medical Center Hospital, Saratoga Hospital, Glens Falls, all working together on this incredible, important project together.
Absolutely. And the leadership of all 4 campuses have already gotten together. We're putting together the structure, the vision, the guiding principles for this very, very important project. And clearly this is a top priority. The only thing that's a larger priority than the EHR ERP is our workforce. So that is what you're going to hear about in the coming months and year. All the things around our workforce and all the things around this project.
That's it. Those are the 2 foundational priorities for the next couple of years. And you mentioned the workforce. We will be needing members of our workforce to help with this project. There'll be large working groups, small working groups, clinical individuals, non-clinical individuals will need your input in order to design the best possible system.
Yes, so many of you will be asked to participate on teams. We need your input. You're the closest to the work. You know how to do this work. You know how to structure the workflows, and your involvement is critical. We have acknowledged, though, that you are all already very busy. So we know that there's not existing capacity to do this work. There'll be resources coming in to help with your day-to-day job, so you have time to work on this very important project. And for those who are interested in a role, certainly reach out to me, reach out to Chris Couchet, reach out to Dennis, and we will be happy to find you one.
Fantastic. Okay, thank you. A couple items just to finish up on. We talk all the time about how we are not just simply a hospital. We are an academic medical center. We're an academic medical system. We have 3 missions. We have clinical care, we have education, and we have research. And it's in that education vein that I'd like to talk about 2 different grand rounds that are coming up, just to bring it to your attention. They're both on the internet today, and I would encourage you to look into one or both of them. The first one, Fran, is a community grand rounds on Omicron. That's going to be from 7p to 8p. That's next week. The information is on the intranet. It's free, of course, but we encourage you to sign up and listen to that really important community grand rounds on that important topic. And the other one comes out of the Office of Health Equity, Diversity, and Inclusion, and that's going to be a panel discussion. And the topic is poverty awareness and healthcare implications. And this one's going to be next Thursday, January 27th. I believe there'll be both in-person and a web option.
Absolutely.
And so people are encouraged. There may be some limited seats in Hike Auditorium. So, you know, obviously, if that sounds like something that you would like to listen in on, and I certainly would, we encourage you to sign up for that as well.
And a quick comment on last week's regarding empathy. The feedback on that has been tremendously positive.
So you're talking about the Schwartz rounds, which are fantastic, and they occur once a month, and we've talked about that on these videos. We certainly will talk about them every single month. These are really important. There's a group of people who organize it every month. It's a chance really to talk about the challenges of being in healthcare, the impact it has on them personally, a chance to share experiences. Everyone's been very positive about Schwartz rounds.
Yeah, and it was perfect timing because there's a lot more that'll be rolling out in the very near future regarding all of your wellness and the types of initiatives that we want to come forward with to promote that day in, day out.
Great, wonderful. Well, I think the audience agrees you are a natural. I may just exit this chair you come over here and you can take it from here. Does that sound like a plan?
No.
All right, well, we'll have you back again for sure. But to those of you who are watching, we're rolling into the weekend. As we say every week, Fran, and I know you agree, we need you now more than ever. We appreciate you now more than ever. Thank you for being there for our patients as we deal with the challenges of COVID and everything else out there. But thank you for being there with us. And we'll be back again next week. We ask that you once again, please take care of yourself, take care of each other, and we will see you next week.
Thank you.